Thank you, Speaker. I rise today to contribute to the Non-Emergency Patient Transport Amendment Bill 2021. And Speaker, this bill is yet another commitment that this Andrews Labor government has to the Victorian community and is a clear indication that we place their health and wellbeing as a priority. It was the Andrews Labor government that in 2018, before the election, committed to the reviewing of the Non-Emergency Patient Transport Act to strengthen compliance and enforcement and ensure the highest quality of care for patients. And I want to thank my colleague, the member for Ivanhoe, for his contribution on this bill. I've spoken in this place many times about the devastation of an impact on Victoria by the Kennett government's cuts and privatisation. Speaker, it was this sector that was also privatised under the Kennett government in the mid-90s. Yes, here we go again because it was the reality. It was taken out of the ambulance services' hands on the basis of profits before patient care. And I'll repeat that again. It was taken out of the ambulance services' hands on the basis of profits before patient care. In fact, some very senior ambulance managers who awarded the contracts owned some of these private transport companies themselves. This was dealt with in the Ambulance Royal Commission in 2000 during the Bracks government. And it was the Bracks Labor government that needed to repair so much damage left behind from the Kennett years. I thank the Minister for Health and Ambulance Services, as well as the previous Andrews Labor government Ministers for Health, in bringing forward this legislation. The journey for many patients starts with these service providers and ensuring that these providers are accountable and are delivering safe and suitable services, and it's critical for Victorians to have confidence in their healthcare system. We have seen the benefits of regulations for our hospital workers and paramedics. It makes sense that Victorians receiving healthcare from these commercial interests are covered by clear regulations that place their healthcare with the same level of importance as our paramedics, our nurses and our other hospital workers already do. Non-emergency patient transport is used for patients who require medical transport but do not need an emergency ambulance response. These services are provided by both Ambulance Victoria in rural areas and registered private transport providers. Non-emergency patient transport is vital to the smooth running of our state's critical care service and helps make sure that Ambulance Victoria's emergency vehicles and crews are available to look after the most critically ill Victorians. In 2018-19, the non-emergency patient transport sector transported 355,000 patients to receive the care that they required. Out of that 355,000, 150,000 of those transfers were transported for Ambulance Victoria by the private operators. The sector has also played an invaluable role in transporting patients throughout the COVID-19 pandemic. And I'd like to take this opportunity to thank the ambulance transport attendants and the patient transport officers, especially for their incredible work of transporting most of the COVID-19 patients to and from hospitals, to and from nursing homes and to and from aged care facilities. This previous year has been difficult for everyone, but these workers really did an amazing job through this difficult time. A review of the Act has not taken place since the Non-Emergency Transport Act was first established in 2003. Many Victorians rely on these services and the ability for paramedics to be available for emergency services rather than transporting non-emergency patients. It is vital that Victorians being transported for medical care are getting a good quality and safe service along the whole healthcare journey. The Act as it currently stands serves primarily as a licensing scheme for non-emergency patient transport providers. The Act does not currently mandate patient safety requirements, and this is outside the expectations of our communities and this government. That is why the Andrews Labor government committed to a review of this Act in 2018, ensuring that mechanisms for compliance and enforcement is an important step. This government made a commitment that we would ensure vehicles and equipment used for transporting these patients are fit for use and include vital safety equipment like power lift stretchers or lifting cushions to be able to lift patients from the ground. We made a commitment that we would keep unsafe or out-of-date vehicles off Victoria's roads. This government has sent a clear message that any non-emergency patient transport provider who flout the rules and put patients at risk will be targeted by snap audits and tough new penalties. These commitments are clearly and proudly reflected within today's bill. That's why With this bill's amendments to the Act, this government will make sure that patient safety is the primary objective of the Non-Emergency Patient Transport Act and not for profits for private companies. I would like to acknowledge the input of the Victorian Ambulance Union in raising these concerns about this sector. Furthermore, this bill will see Victoria, yet again, lead the way regarding patient safety by becoming the first Australian jurisdiction to regulate and place clinical governance requirements on commercial first aid providers. There is no place in Victoria for businesses that places commercial interests over patient safety. The bill is set to come into force on 1 September 2021, and these amendments in this bill are a positive step for patients and the care they receive, but it is also an important change and protections for the workers that do the job. The amendments send a clear message that it's not okay to cut corners when it comes to health and safety of patients or non-emergency patient transport workers. One of the changes will enable unannounced inspections of vehicles when on road through measures such as snap audits. This will mean vehicles can be checked to see whether they are fit for purpose and not out of date, and they are carrying vital safety equipment. This bill will set minimum clinical standards across both the first aid and non-emergency patient transport sectors and will demand that non-compliant providers either lift their game or exit the market. And this bill will also allow for amendments to the non-emergency patient transport regulations. And some of these changes in those regulations will be introduction of power lift stretchers and lifting cushions, as I previously said, introduction of vehicle life limits and annual roadworthy checks, requirement for any PT licence holders to operate to an accredited occupational health and safety plan, strengthened training requirements including a new requirement for mental health training, and introduction of clinical governance requirements to improve patient safety and quality care. The power lift stretchers and lifting cushions have been equipment that paramedics have used for many, many years, and unfortunately in the private sector, that practice and provision of that equipment has not been provided to the private sector workers, and I'm pleased to say through these amendments it will be provided to them, and that will mean that patients will be treated even in a more safer way than what they currently are. As I mentioned earlier, I met with the Victorian Ambulance Union delegates recently to discuss their concerns in this sector, and they detailed their concerns in writing to me, and I would like to refer to some of them now. One of the major issues they raised was casualisation of the workforce. And unfortunately, through that casualisation of the workforce, we see a number of practices in the private sector go on because people are too fearful of raising those concerns. We know that they've stated that they know that OH&S matters go unreported because people do not want to be seen to rocking the boat. We know that some employers employ in excess of 170 people, with only a handful of those people being permanent staff. Double loading, that's where you load 2 patients into the back of an ambulance vehicle on 2 separate stretchers. Very minimal distance between the two. But these double loading situations are totally inappropriate due to the situation of the patient and the conditions of the patients. And we see situations where in double loads where you might have palliative care patients nearing end of life, behavioural patients, dementia patients, mental health patients, patients with poor hygiene, infectious patients. And an example of this occurred during COVID-19, where these workers were forced to transport two patients in the back of these vehicles, right, and there could have been cross-infection. And it was only after DHS had put out an instruction to these private providers that practice has stopped. But the pressure was put on those workers by their employers to do double loads. It's totally inappropriate. The other issues that they raised were the vehicles, the life limits of vehicles. And we know that some of the vehicles in this sector are in excess of 500,000 kilometres and a lengthy period of time, and an aged vehicle. That would never happen in the ambulance service. Those vehicles are removed after 3 years or 240,000 in the ambulance service. So you imagine a poor patient in the back of these vehicles that's rattling along the road after 500,000 kilometres. It is just inappropriate. So I'm pleased to say that standard will change and it will be improved. And we know about some of these vehicles that in recent times there was a crew that unfortunately had some carbon monoxide poisoning through exhaust fumes into the back of the ambulance. They were transported to hospital, but the company got a patient transport officer to go and pick up that car and drive it back to the depot, not even put it on a tray truck and drive it in. It's just ridiculous what goes on. So I'm pleased that these amendments will address that. And that's why I've spoken to this bill today. And as I say, I commend this bill to the House. Thank you.